I am Dr. Yager. I am associated with the School of Medicine in San Diego. I am here primarily to teach the method I call subliminal therapy. However, I am delivering a couple of short presentations here. The first one today is going to be on addictions. I have some different understanding of addiction. This different understanding was derived from my work using subliminal therapy. This concept of addiction is really a kind of a different way of thinking about it. It's by informal definition, that's the first up there on the screen. It's a state characterized by compulsive use in the case of chemicals, compulsive involvement in behavior in the case of addiction to gambling or addiction to another person. It's and it further defined as this activity taking place despite adverse consequences. Now, in the case of chemical addiction, the reward for the behavior is likely to be avoidance of the trauma of withdrawal. Now, we talk about addiction to street drugs, to prescription drugs. These are chemical addictions. And this type of condition has these characteristics of withdrawal if you stop using it, and tolerance if you do keep using it. Withdrawal from most of the street drugs is not a nice experience. It's terrible. They will do most anything to avoid that experience. And the most convenient thing is to reuse, which of course complicates the problem. It's one of those intracycle things that is very self-defeating. Now, in the case of, say, gambling addiction, is pleasure. Pretty consistently, simple pleasure is the driving force. Well, we think of pleasure as a kind of an optional thing in general, but it can be a true driving force that will not be ignored. We see that in sexual addiction. We see that in addiction to gambling. We see that in various ways in our patients. What I have learned is that the problem is fundamentally, whether it's chemical addiction or non-chemical addiction, the problem is fundamentally a psychological problem. Well, does medical intervention fit the picture? Absolutely. It fits the picture in terms of managing the symptoms, managing the process of withdrawal. Well, if addiction is the consequence of conditioning from life experiences, if that's true, it makes sense that reconditioning would be the preferred treatment. Pure logic. And it is possible. And I'm going to be talking a little bit about how it becomes possible. For successful psychological intervention, regardless of the method employed, if it's treating chemical addiction, these three elements are essential to begin with. The patient has to be motivated. There has to be a subjective element of influence that makes it possible for the change to take place. There has to be adequate intellectual ability. And that blends into the third one. They can't be using the damn drugs. They have to be free of them. They have to have gone through detox. They have to have established clarity of thinking. And, of course, drugs seriously compromise our ability to think clearly. Now, this method that I want to speak to here, I have named subliminal therapy. It's a method that has proven remarkably effective in treating psychogenic disorders. That is, disorders that are the consequence of life experience. Many problems turn out to be psychogenic. Many mental problems, yeah, but also many physical problems that have been diagnosed as medical issues. That's the first assumption of this method. The second assumption is that all of us have mental abilities that exceed our conscious abilities. Evidence of that is most everywhere you look, if you look for it. Just the maintenance of the vital functions of the body takes place without conscious involvement at a degree of sophistication that I don't think we can consciously even comprehend. We do have these abilities. Well, if we have this extra conscious, higher intelligence, it makes sense to tap into that ability to solve problems. Well, that's what this method is all about. And these methods can, in fact, be engaged for that purpose. I have kept records for several years now of my success rates, of these success rates of my patients. I do this by this simple, easily completed single-page inventory. How and to what extent is this problem affecting your life? I ask the patients to complete it before treatment, after treatment, and whenever possible as a follow-up. This is the data that I have obtained. Now, I certainly recognize this is a very small sample. I don't see that many addictive problems. Nevertheless, these numbers call for attention. In chemical addiction, and most of these are street drugs, meth, heroin, some marijuana. These addictions are extremely difficult to actually resolve. We can make life easier. We can mask chemically, we can pharmacologically mask the symptoms of withdrawal to some extent. Using hypnotic technique, we can make that an easier process also. But given that this addiction, even though it's manifesting in chemical ways today, the root of it is psychological. Well, in treating that psychological root, 90% success. That should get somebody's attention. And to get that, as I recall, 7 of those 9 had complete remission. No longer addicted, no longer wanting, interested in, thinking about, just not a part of their lives anymore. Well, I separated nicotine, smoking, for some reason. Same rate of success. And then I separated out these 2 remaining ones. One was gambling addiction, and I don't remember what the other one was. And it's still up there. Very high success rates. Now, in the brief period I have up here, I cannot predict, I cannot talk about this method, I can't describe it. I'm very time limited, but I do want to answer your specific questions. There will be 4 of us presenting here this morning. That leaves us half hour apiece. So I would like to spend this the next portion of my time, which looks like it's about 15 minutes, answering your questions. Is there a portable microphone for that purpose? Okay. So if you have a question, please feel free to ask.
Hi, can I ask, you talked about the therapy that is successful for chemical addiction like heroin and 2.5 hours success. What happens with the withdrawal symptoms that take place with harsh chemical addictions like heroin? How the patients are after the therapy? How do they deal with the withdrawal symptoms of stopping using?
Well, let me answer it this way. In using this, will you please put up my last slide again? Keep it up there. In using this method, the criteria for success is total remission, total resolution. There are no symptoms that have to be addressed further. There is no longer any withdrawal. There is no longer any desire to use or to gamble or to be with that person or whatever it is. As defined using this method, that's the criteria for success. Now, if you go to the websites, to the next, that one. If you're interested in this, interested in pursuing this further, there's a wealth of information at those 2 websites. Success rates in treating a wide variety of other disorders. There are over 300 cases detailed. If you're interested in the statistical aspects, if you're interested in the theory, that's there too. There are videos that you can observe of this method being employed in actual treatment situations.
I have a question here. Is there not a neurochemical and a physiological aspect to addiction? Is that taken care of in subliminal therapy?
I'm sorry, I did not understand that question. Is what taken care of in subliminal therapy?
The neurochemical aspect of addiction.
I cannot adequately answer that. I don't have an objective answer. I want to do that research to determine that. I suspect that that our famous guy is accurate, that it is possible to change the manifestation of the genes, the biology of belief. It is possible to make essential neurological changes if we know how to do it. I suspect that has happened here, but I cannot say, yes, that did happen. Adequate answer?
You mentioned that when using subliminal therapy, one of the prerequisites is that there should be no chemical influence at that time. In terms of, and I would take that to mean either of the drug of addiction or pharmacotherapy.
That's correct. Well, again, I am a psychologist. I cannot say whether or not pharmacotherapy actually compromises intellectual functioning. It certainly compromises, masks, hopefully anyway, the unpleasant aspects of the symptoms. Makes the transition of metabolizing the chemicals and offloading them, we call it withdrawal, makes that process easier. My concern is that employing this method requires intellectual competence. I know that street drugs compromise that. I know that heavy emotion can compromise that. I can't answer that. If you're a psychiatrist, perhaps you have the answer.
I'm a psychologist. Let me be a bit challenging here, if I may.
Keep going.
In order to help the client get off chemical dependence, there may be the role of pharmacotherapy to get to, for example, to control the symptoms of withdrawal. If they are already on chemical dependency and you're going to use subliminal therapy, then you said they should be off the chemical at that point.
Yes.
Which means that either they can do without it for a while, or they're going through withdrawal. How would subliminal therapy work for someone who's going through, say, withdrawal, or is already on pharmacotherapy to help alleviate the symptoms of withdrawal? It's almost like a bit of a catch-22, isn't it?
Let me put it this way. The mental processes that take place in this higher level of mental functioning take place independent of the symptoms. I am maintaining here that in the case of chemical addiction, the driving force that propels the behavior is a psychological force. Now, it may be inspired by fear of withdrawal, may be inspired by several possible things, and it is a psychological force. If you treat that psychological force, the rest of it falls to the wayside. That's grossly oversimplified, but that's what happens.
How would you then deal with the dependence aspect when they come to you? Because they're still hooked on a substance.
Yes.
Coming to you for subliminal therapy.
Mm-hmm. I am saying, sir, that the hook itself is the psychological addiction, the psychological component of addiction. Is it chemically mediated? Yes. But the consequence, it's like in chronic pain. Many cases of chronic pain were originally inspired physically, but over time, the physical has healed. There's no longer any organic basis for pain, and yet they have it. It's inspired psychologically.
How would you then help them with the chemical dependence aspect?
The same protocol applies, whatever the presenting problem, in using this method. You bypass all of the limitations of conscious opinion and convictions and belief, and engage this higher level of mental functioning directly, logically. I realize that I am speaking, the word unconventional doesn't apply. I have been training people all over the world in this method. The Mexican government is now engaging a major study applying this method for addiction problems, chemical addiction problems there. They believe it. They've seen enough evidence that they're going to really test it. Well, as an independent psychologist, yeah, I have the kudo of clinical professorship, but I don't have the money to do that kind of study. I can do only what I can do within my office. So even though it's limited, nevertheless, those numbers carry conviction, and I am out of time. I have a couple of handouts for you that my friend Christina will distribute. One is a paper on addiction, the other is a paper on chronic pain. If you have further questions, interest, please reach out to me. And if you wish to be on the mailing list of the institute where recent developments are posted, Christina also has a list that you can sign up. Give me your email. You'll be put on that list if you have that interest. I thank you for your time. Hope to see you another day. Now, our next speaker, Pablo Lopez Silva. Pablo, are you here? Well, no Pablo. No Dr. Lopez Silva. So, why don't you introduce the next